Hey everyone, Dr. Jamie here. And I was wondering, have you ever heard of iatrophobia? Interesting word, eh? So iatrophobia is the irrational fear of doctors or medical treatment. This phobia can be triggered by past traumatic medical experiences or fear of bad news or general anxiety around authority figures in healthcare. And before I go further, I just want to remind you to like this video and please subscribe to support our channel. Anyhow, people with iatrophobia may experience intense dread, panic attacks, or physical symptoms such as sweating, trembling, heart palpitations, nausea, just at the mere thought of visiting a doctor. Even something as routine as a checkup can provoke extreme anxiety, leading to avoidance behaviors. I mean, would you want to go to the doctor if you had impending doom hanging over your head? Not likely. But this avoidance can have serious consequences, like for a person's health. I mean, people with iatrophobia often delay or completely avoid seeking medical attention, even when experiencing symptoms that clearly require evaluation. This fear can uh, prevent like early detection of serious conditions and limit routine care like screenings and increase the risk of complications from untreated illnesses. So it's really important, it's a thing that needs to be taken seriously. In extreme cases, people may go to great lengths to self-diagnose and self-treat, further endangering their well-being. In fact, I knew a person once who actually waited almost 20 years to have a lump on his head looked at. It had become the size of a golf ball and had started like oozing blood and pus and all that uckiness from all around it. And anyhow, his fear of medical care was so intense. It was more intense than the concerns that he had around, what people thought about him and his apparent twin growing out of his head. Considering how much we tend to care what others think, that's pretty intense. I mean, he finally got himself into the doctor, thank goodness. And it took a lot of work, only to find out that it was a malignant tumor that he had to have a Mohs surgery on. Now he has a large indent in his forehead, which, by the way, bothers him in regard to what others think. Luckily, so far so good. No cancer coming back. Yay! Um, but this phobia can also affect emotional and social well-being. People may feel isolated or ashamed or stupid, um, you know, like thinking that their fear isn't uh, normal. So, particularly when others don't understand or take it seriously. It can also really strain relationships with loved ones who encourage them to seek care. In some cases, people may benefit from therapy, particularly from cognitive behavioral therapy, which helps to identify and reframe harmful thought patterns. Gradual exposure and support from empathetic healthcare providers can also not only help reduce the intensity of the fear over time, but it's imperative. Doctors need to take this seriously and take the time to talk to you about your concerns and do their genuine best to alleviate them. So, if you have iatrophobia, I really encourage you to get some professional help and really work toward healing. Do it for yourself. All right, thanks everyone, and I hope that you have a beautiful day.